Every year, countless seniors walk into their doctor's office for routine checkups, believing they're taking all the right steps to protect their health. They get their labs, their vitals, and sometimes a few scans just to be safe. But what if I told you that some of these seemingly routine tests, yes, the very ones ordered by well-meaning physicians, might actually raise your risk of stroke, particularly if you're over the age of 60? It sounds far-fetched, maybe even alarming. After all, these tests are prescribed by trusted medical professionals. You follow every piece of advice, take every medication as directed, and show up to appointments on time. But hidden in the small print of modern medicine are silent risks, complications. Rarely discussed in the brochures at your local clinic or during brief conversations in exam rooms. Imagine walking out of an annual checkup feeling reassured, only to experience blurred vision, dizziness, or even suffer a mild stroke a few days later. The truth is, certain diagnostic procedures, especially when done too often, without clear necessity, or in the context of existing conditions, can quietly trigger dangerous changes in blood pressure, disrupt your body's balance, or even prompt clot formation that leads to brain injury. This video isn't about fear. It's about awareness, about giving you the knowledge to ask the right questions and protect yourself and your loved ones. Because after the age of 60, medical care isn't just about detecting disease, it's also about avoiding harm that well-intentioned procedures might accidentally cause. In the next few minutes, here on Dr. Alicia's MedTalk, we're going to explore 5 common medical tests that carry underappreciated stroke risks for seniors. And more importantly, we'll walk you through the specific steps you can take to reduce those risks and advocate for safer options. If you're over 60, drop a 1 in the comments to let us know you're here. If you're younger, drop a 0 and make sure to follow the channel. We're here to uncover the truth about aging and medicine, especially the things no one else will tell you. Let's begin with a scan many of you have likely experienced, the CT scan with contrast. You may remember the warm, flushed sensation after that injection. As the contrast dye courses through your body to help the scanner produce more detailed images, it sounds helpful, and often it is. These scans can reveal clots, tumors, bleeding, and more. But what most seniors aren't told is that this contrast dye can significantly impact the cardiovascular system, especially if you already have conditions like high blood pressure, kidney dysfunction, or heart disease. For some people, it causes a vasovagal response, a sudden drop in heart rate and blood pressure that leads to fainting or dizziness. For others, it causes the opposite, a sharp spike in blood pressure, which can strain fragile blood vessels in the brain. A study from the Journal of Vascular and Interventional Radiology revealed that older adults who underwent contrast CT scans had a noticeably higher rate of vascular events within 72 hours. Consider the story of an 81-year-old man who went in for a CT after some mild digestive discomfort. The scan was normal. 2 days later, he suffered a minor stroke, likely triggered by a temporary spike in blood pressure from the contrast dye. This doesn't mean you should avoid CTs entirely, but it does mean you should always ask your doctor, is contrast necessary for this scan? Could we do this another way? Non-contrast CTs or ultrasounds can often provide the same answers without the same risk. Next, we turn to a test many people over 60 are encouraged to take even when they feel perfectly fine, the exercise stress test. The premise is simple: monitor the heart under physical stress to detect signs of hidden disease. But for seniors, especially those with pre-existing vascular issues, it can carry hidden dangers. During the test, you're placed on a treadmill and asked to walk or jog as your heart rate, rhythm, and blood pressure are tracked. But what happens when that already aging heart is suddenly asked to perform under pressure? It may react with irregular rhythms, pressure spikes, or even vessel rupture in rare but real cases. A study published in the American Journal of Cardiology tracked over 1,300 seniors undergoing this test. About 7% experienced complications such as abnormal rhythms and blood pressure surges. One of our viewers, Margaret, age 74, underwent the test on her doctor's advice. She had no symptoms but a history of hypertension. During the treadmill test, she felt dizzy and short of breath. The next day, she had a minor stroke. The stress of the test likely caused a vessel in her brain to rupture. Always ask your doctor, is this the safest way to evaluate my heart? Medication-based nuclear stress tests or resting echocardiograms may be better alternatives for people with existing heart conditions. Now let's talk about something that feels routine, so routine that many people don't give it a second thought. the sedated endoscopy or colonoscopy. These procedures are recommended frequently after age 52, monitor for cancers and digestive disorders. But when done without clear necessities, especially if you have no symptoms, they may pose unnecessary risk. The primary issue isn't the scope itself, it's the sedation, especially when paired with blood-thinning medications like aspirin, warfarin, or Plavix. Sedatives can cause blood pressure to drop during the procedure. Combine that with medications that prevent clotting, and you have a recipe for internal bleeding or even mini-strokes, known as transient ischemic attacks, TIA. A 2021 review in gastrointestinal endoscopy found that adults over 65 were more likely to experience stroke-like events within 72 hours of sedated endoscopy. One case stands out. A 76-year-old woman went in for a routine colonoscopy with sedation. She was on aspirin. 2 days later, she developed slurred speech and balance issues, symptoms of a mild stroke. Doctors believe sedation-induced low blood pressure combined with her medication likely contributed. The takeaway: if your doctor recommends a scope, ask, why now? Are there other options? If you're not having symptoms, a wait-and-watch approach may be safer. And always ask if the procedure can be done without sedation, or with lighter alternatives. Especially if you're on blood thinners. Let's move now to a test that gets less attention, but may carry more risk than people realize: the MRI with contrast. These scans use gadolinium-based dyes to highlight tissues and blood flow. While the images are incredibly detailed, the dye used doesn't leave the body instantly. Your kidneys have to filter out the gadolinium, and that becomes a problem if your kidney function is reduced, which is very common over age 60. If the gadolinium lingers, it may lead to nephrogenic systemic fibrosis, NSF, a rare but serious condition that causes hardening of tissues. More concerning, recent studies show that retained gadolinium can accumulate in the brain, especially in areas responsible for balance and memory. A 2019 study in radiology found that 5% of patients over 65 who had contrast MR reported neurological symptoms like dizziness, brain fog, and blurred vision within a week. Harold, a 79-year-old veteran, underwent a contrast MRI for back pain. He felt weak, foggy, and off balance for nearly a week after. Later, it turned out he had undiagnosed stage 3 kidney disease. The solution: ask your doctor if contrast is absolutely necessary. Often, non-contrast MR or alternative imaging may be sufficient. If contrast is required, ask for a GFR test to check kidney function first. Finally, let's look at the carotid artery ultrasound, a quick scan used to detect narrowing in the arteries that supply blood to your brain. Sounds smart, right? Especially if you're trying to prevent a stroke. But here's what many don't realize: this test, when done without symptoms, can lead you down a path of risky surgeries. If a scan shows 50 to 60% narrowing, it may sound alarming, but research shows that in the absence of symptoms, most people do not benefit from surgery and may actually be harmed. The New England Journal of Medicine followed over 3,000 seniors with moderate carotid narrowing and found that lifestyle changes and medication often worked just as well as surgery in preventing strokes. In some cases, the surgery itself caused strokes, either during or shortly after the procedure. Helen, 82, learned this the hard way. She felt fine but had a carotid ultrasound during a checkup. It showed 65% narrowing. She was rushed into surgery. Sadly, she had a small stroke during the operation and now lives with partial weakness. Always ask, what are we looking for? What will we do if we find something? Don't let a scan lead to a surgery you don't truly need. To wrap this up, here's the key message from Dr. Alicia's MedTalk. Not every test is dangerous, but not every test is necessary either. After age 60, your body changes. What once was routine might now be risky. An injection of contrast dye might raise your blood pressure. A treadmill test could strain an aging heart. A sedated scope might tip your brain's balance. That's why asking the right questions matters more than ever. Ask, is this test necessary? Is there a safer way? What's the risk, given my history? Speak up. Be your own advocate. Because informed choices create better outcomes and better peace of mind. Your health matters. Your voice matters. And here at Dr. Alicia's MedTalk, we'll always tell you what others won't.